The equine skeletal condition of laminitis. Laminitis is an extremely painful, recurring skeletal or abnormality in a horse's foot. It can also be found in ponies and donkeys. This condition puts the horse's welfare and quality of life in question for the owner because of how painful it can be. Laminitis affects the tissues, which are called laminae, that bonds the hoof wall to the pedal bone or coffin bone in the hoof. This can cause the pedal bone and coffin bone to shift or rotate in the hoof, which is what is so painful for the horse. This condition does not kill the horse, but it does make the owner have to make a very tough decision whether or not to euthanize the horse if it is in too much pain. This diagram is the changes that occur to the foot as a result of laminitis. As you can see in here, the pedal bone is kind of angled towards the edge of the hoof, which is what it's supposed to be doing. This right here is the laminae, which is the tissue that gets inflamed. And this is the hoof wall. And this right here, you can tell that the pedal bone or coffin bone is angled down instead of towards the end of the hoof, which is what is so painful for the horse. And you can tell that the laminae is in a different angle also. Laminitis can be both chronic and acute when the laminitic foot has gotten so bad that it has become foundered, which means the coffin bone has rotated, which means that it is now a long-term case, which is basically what chronic means. Chronic means that it's a long-term disease. When laminitis is acute in a horse, it has its episode where there is pain in the hoof and the laminae is inflamed. Then after a couple of days or a couple of hours, the inflammation goes away. This disease is very important to discuss because not many new horse owners know what it is. Most of the time, they just think that their horse is lame and there isn't something actually going on inside the actual hoof. People need to know about how painful this actually is for a horse, and sometimes it is best to not let them suffer through the pain. 7% of equine deaths are euthanized from the pain of laminitis. The signs of laminitis include lameness that is affecting at least 2 or more limbs, abnormal hoof rings, shifting weight between feet when resting because of the pain, increased digital pulse, blood vessels seen in the hoof wall when the farrier comes and they cut and they trim the hoof. You can see a little red spots, which are the blood vessels. That's not normal. Pain with use of hoof testers on the hoof of frog, leaning back to take the weight off of a painful area. When we are talking about laminitis, we are talking about the inflammation on the laminae tissues, laminae tissues in a horse's hoof. As you can see in the image below, you can tell right here the laminae, this is what gets inflamed. In a laminitic foot, this coffin bone is pointed down, and the laminae is very much inflamed. It is caused by a lot of sugar intake when they are foals. For example, if the horse is put onto lush pasture too early in their life and overfeeding grain, that can give them too much sugar, which can cause laminitis. It can also be caused by endocrine diseases such as equine metabolic syndrome, EMS, or pituitary pars intermedia dysfunction. Laminitis is sadly irreversible. So right here is the laminae, the hoof wall, the coffin bone, and this is the frog. In the first diagram in this paper, you can see what the laminae looks like in a normal hoof, compared to a laminitic hoof. Laminitis is often bilateral and can be in more than one foot. It can often be in all 4. A couple things you could do at home is to check your horse's hoof for possible laminitis is the hotness of your horse's hoof. Horses' feet should be around the temperature of the outside, but horses that have hooves that are hot to the touch, that this is not normal and there's definitely something wrong, whether it be an abscess or in some cases laminitis. Another thing you could do is check the digital pulse in your horse's leg. That's when you go behind your horse, run your fingers all the way down to kind of where that his ankle is, and you can feel right below his ankle there should be a pulse. You should barely feel that horse's digital pulse. If it's strong, then there's definitely something wrong in your horse's hoof. If your horse has these things, call the vet, and they will actually come out and do a radiographic finding, like an x-ray, which gives you a picture like the one above to see the angle of the coffin bone. In the pictures, you can see that it is a distal part of the horse's body. Overall, this disease can be very painful for a horse and can cause a hard decision for the owner. Laminitis is a plantar skeletal condition because it inflames the laminae in the horse's hoof, which is the most important part, which is another reason why it is so painful. Horses, even when they sleep, they don't usually lay down. They usually lock their two front knees and stand all while they're sleeping. So the feet of a horse is probably the most important part of the horse, which is why most people put their horses down if they have severe pain. They do make special boots for horses with laminitis, but depending on how much pain your horse is in, it is sometimes best to not let them suffer. So, if you have questions about laminitis, I have citations down here, and you can always call your vet. Thank you so much.